Hi, my name is Dr. Sharita King. I practice at the Medical College of Georgia in Augusta, Georgia, where I am a urologist that specializes in men's health and erectile dysfunction. So let's talk about partners of patients with erectile dysfunction. So it's important to remember the impact that erectile dysfunction has on the man, their partner, and that relationship. 42% of women feel that their partner's ED is their fault, and 94% of men feel that their partner support is very important. It is important to remember, as a partner of somebody with ED, you are not alone. 40% of men by the age of 40 will suffer from erectile dysfunction. And there are 30 million men in the United States that suffer from erectile dysfunction. So if you're a partner, it's important to remember, don't blame yourself, because 80% of the time, erectile dysfunction is due to a physical problem. So now the question is, how do you start this conversation with your partner? The best way is to remember to be open, honest, caring, and supportive of your partner. They are just as frustrated as you are, if not more. So now that you and your partner are on the same page, there are different treatment options that are available. They range from medical treatments all the way up to surgical options. The first option is oral medications. With the oral medications, it's a pill that you're going to take at least an hour prior to intercourse, and they require stimulation. The pros with this is pretty minimally invasive. The cons that go along with this are the loss of spontaneity, the risk of side effects such as flushing, headaches, and muscle aches and cramps. The next option is urethral suppositories or pellets. These are pellets that you'll push down into the urethra in order to get an erection. Again, these require manual stimulation and should be done prior to intercourse. The pro is you don't have to take it at least an hour prior to intercourse as you do with the oral medications. However, the con with this one is that you'll get urethral burning in most patients. The next option is the vacuum erection device. With the vacuum erection device, it is a cylinder that you place over the penis that applies a pressure to the penis or a vacuum, and it pulls blood into the penis. Then there's a band that's at the bottom that you put at the base of the penis in order to trap the blood in. With this, the pros are that it acts pretty quickly. The con, though, that goes along with this is with that band, you can get some numbness and tingling in your penis over time. Next, we have injection therapy. With injection therapy, you're taking a liquid medication and injecting it directly into the side of the penis. With this, the pros are that it can act pretty quickly within 5 to 10 minutes of administering the medication. So it gives you some spontaneity back. The cons that go along with this is pain with injections, and you can also get scarring at the injection sites. And then you have the penile implant. With the penile implant, there are two main types. You have a semi-rigid and you have a 3-piece inflatable. With the semi-rigid, it's a device that you would bend up and down in order to conceal the erection, or if you're ready to have an erection, you pull it up. With the inflatable, you have 3 pieces. You have cylinders that are within the penis, you have a reservoir that sits in the abdomen, and you have a pump that sits down in the scrotum. And when you're ready to have an erection, you squeeze the pump, it pulls fluid from the reservoir and puts it into the penis to get you an erection. The pros with this is that patient satisfaction for the penile implant is a lot higher than all of the other treatment options. Another pro is that you get the spontaneity back in your sexual life. You don't have to worry about bothering with the other treatment options, fiddling with injections or trying to find your pills and making sure you time them appropriately. However, the cons that go along with the penile implant are risk of infection. Another risk is the risk of malfunction of the device. However, at 10 years, over 75% of devices are still functional. And then you have the risk of dependence. So once you get a penile implant, you're always going to be dependent on it in order to get an erection. So if it's removed, you will not be able to get an erection naturally. So now that you've seen all the different treatment options that we have, remember, I love incorporating partners into this discussion. I have found that they are great allies for my patients as they're going through this journey of erectile dysfunction. And especially once we get to the point where we're talking about surgical options and post-op care. So if you want to learn more about erectile dysfunction and find a physician that your partner can talk to, please go to coloplastmenshealth.com and click on Find a Physician.